Welcome to COVID-19 Talks with local health authorities. I have with me Dr. Umair Shah, representing Harris County. And we have a guest, Dr. Catherine Troisi, infectious disease epidemiologist from UT School of Public Health. Dr. David Persse wasn't able to join us today. Also, I want to acknowledge that this program is sponsored by the Rotary Club of Houston, and special thanks to past President Kathy Finninger for providing these questions for us. Okay, last week you warned against complacency as positive numbers drops to 5%. Last I heard, they are now up to 5.6%. A Baylor doctor attributes it to mass fatigue, changing weather, and business getting more crowded. Your thoughts?
Well, and first of all, let me start by welcoming Kathy, Dr. Troisi, a colleague of ours for years, and just really welcoming you to this program.
Thank you.
You know, I think this is the real challenge that we've had throughout this whole process is that, you know, the positivity rate was decreasing, and we went from those mid-20s down to 5.5%, 6%. And now we hit this nadir, and then it looks like it's kind of plateaued, and now it's starting to inch back up. And the question is why? And the question is this COVID fatigue? Is this because people are, you know, indoors? Is it because schools have reopened? Is it because we got people in business? Is it because we're all just doing our thing and not everybody's wearing the mask and doing those other things? Is this something else? And the answer is A, B, C, D, E, all the above. And we just don't know how much of any of those factors. But this is why we have to remember we're still in this marathon of a pandemic, and we need to continue to do the things to get us out of it.
Yeah, and another thing that we're concerned about is the lower humidity, which is great for us, but also great for the virus, and that may be contributing as well.
Could be, yeah.
Okay, describe the calculation of the positivity rate.
Yeah, it's really the positivity test rate, or test positivity rate, I guess. So you take the number of tests and the number of people who tested positive, and you divide the number of people who tested positive by the total number of tests. And that's the test positivity rate.
So it's relative to the number of people who actually take the test.
It is.
Right. Okay, David isn't here, but Dr. Persse, you mentioned in a press conference that those recently infected tend to be younger. Are they transmitting to their peers or back to their families?
You know, this is and again, I'm not Dr. Persse, but I'll just speak, you know, on his behalf here. Is that this is a trend that we saw actually for the last several months throughout our community, but also across the country. And what that was is that early in the pandemic, we were very concerned about seniors, older people who were coming positive. And then we started to see a shift where there was maybe less of those, and it wasn't that the numbers were less, but the proportionality of those were less than the numbers that you started to see with younger populations. And we don't know exactly why that is, but I think you can surmise that a lot of it has to do with people going out and about, working, going to, you know, a restaurant or going to a gym, or just saying, look, I don't need to worry about it, I don't need to wear my mask, or I don't need to do those things because I'm not at risk for complications, when the actuality is that you are, and that's why you're seeing numbers that are, even in the hospitalizations, that are increasing in the younger population. So again, we're all in this together, and we have to keep fighting it.
Okay, Dr. McDevitt at Baylor said we are already in a new surge with the majority of cases in healthy 20 to 30-year-olds. Is that sounding rather normal or more like the flu?
It is true that depending on the strain of flu, that age group may be affected the most. Sometimes, I mean, older people are always affected, as are very young children. However, COVID-19 is not like the flu in that it is a new virus, nobody has immunity, and so everybody is susceptible. It has a higher case fatality rate. More people die from COVID-19 if they're infected. So it would be wrong to think of this new virus just as a seasonal flu.
Okay. I understand you need to self-quarantine if you have been in close contact with someone who is positive. A number of HISD campuses have closed temporarily because of presumed or confirmed case. Can you explain the protocol?
Yeah, did you want to talk about HISD yourself? And then
why don't you just explain the regular protocol, because this is a little bit different situation.
Yeah, so the protocol is that, and we've been working with schools, and really, again, shout out to all of our school administrators and everybody in the education system that's working in a very difficult time for our entire community. So what this is that as the schools are coming back, they are now having reports of either students or other faculty members who have symptoms. And when they have symptoms, there are two ways to do things, right? One is to say, because of symptoms, we're going to assume you have COVID-19 until proven otherwise, or we're going to pull you out and we're going to get you tested and separate you from everyone else. That's the public health message, though we also want to make sure that you presume that somebody is going to be, COVID-19 until proven otherwise as well. And then that's where contact tracing comes in. Then we start to, one, get a test result. If the test result comes back positive, we determine who else was exposed around that individual. If it's just a few people, and then you can go ahead and make decisions based on the few people, or if it's in a classroom, you can close a classroom. But if you feel that it's multiple classrooms, 2 or 3, actually ours is 3 or above, that you actually can then say, close the school. Now, how a certain school district does it, that's the real art of how this all works. And so maybe you can talk about HSD.
Yeah, just to summarize it, I think in conversations with the district, they did that out of an abundance of caution. They cleaned the campuses. They're open today. We have been working closely with them yesterday and today. As a matter of fact, we're going out doing site visits at several of the schools. And we're actually going to recommend that they move closer to the public health recommendations in terms of their protocols.
Good.
On October 18th, Mayor Turner announced that sanctuaries and faith-based organizations are beginning to reopen at 25% capacity. My church has been open for weeks and say they are now at 75%. What gives? Please also explain to her task force.
Well, I'll let you talk about the task force, but I will say that this has been the real concern is that, look, we're giving public health guidance. We're giving guidance the best that we can under the constraints that we have been given by the state. The state ultimately makes the decision on what percentages and how quickly and how which sectors open and how they open. And what we can do from a public health standpoint is to give the guidance on how to do that safely and effectively so you can minimize risk. Now, if the mayor is saying 25% and then an individual saying, yeah, but my church has already been at 75%, well, that's an issue, right? We would rather that the 75% wasn't happening. Now, we're hopeful that all the other things of the 3 W's we've talked about, right? Wear a mask, watch your distance, wash your hands, that was also happening at that at that church that this individual is talking about. But again, that's what that's about. And the HER task force.
The HER task force actually is the Health Equity Response Task Force. Mm-hmm. Basically, it is an initiative that was created by the city to ensure access and inclusions of communities that are disproportionately impacted by COVID. And so there are a number of initiatives that the HER task force has been engaged in. For instance, ensuring that people in various communities have masks. Also, there have been a number of food drives and offering of support services for those communities that were disproportionately impacted by COVID. Airlines have a good week with the recent news that air circulation in planes is better than our homes. Are you a believer? And will you take a flight soon? When you think it's safe, I'm right behind you. Kathy, you answer that question.
Yeah, this is near and dear to my heart because I have grandchildren in other cities that I have not been able to see. It is true that airplanes are relatively safe. There is air exchange HEPA filters that can take the virus out of the air. However, there have been documented cases of transmission of COVID, but in longer flights, usually international, so 10, 12 hours. On the other hand, I will say personally that I had a flight scheduled a couple weeks ago, and I canceled it the day ahead of time, the day before, because the plane was full. This was an airline that allowed middle seats to be filled, and I just didn't feel comfortable.
So would you say that a message to travelers is to try to find some off times to travel?
Absolutely, and I think you have to make, like with everything, cost-benefit analysis. If you're I had a friend who had to go to Europe because her mother was not doing well. You take a risk then.
Yeah.
If it's purely for a fun thing, maybe you wait.
Maybe you wait, or
Yeah.
you drive. Yeah.
Or if you can, yeah.
Not to Europe.
Not to Europe.
Not to Europe.
That's right.
Colorado's governor took 12% of their death numbers off their list because their totals were inflated. How accurate are ours?
Well, you know, I do think that our numbers are accurate, but I will say that, you know, an ongoing issue that we've had is reconciling local, county, city numbers with what the state is reporting. And we now are receiving death data from the state, and we're actually now able to look at that information and reconcile. So the state actually has a higher number that's reported for Harris County versus what we locally are reporting, and we're still reconciling that. But I will say that ultimately our numbers are actually quite accurate. And you know, I don't know what's happening, you know, with that comment about Colorado, but I will say this has been a challenge. And I think the biggest issue, and that people to forget, is that with deaths, it's hard to know that is this a COVID death? Because so if somebody is driving a car and they got short of breath and they get into an accident and they die, do you attribute that to COVID or do you attribute that to the accident? And that's, I think, where the gray zone comes in.
Okay, an acquaintance just surfaced for the first time since March and told us she had been infected with COVID following an unrelated surgery and then hospitalized for months. How frequent is the infection after a non-COVID related hospitalization?
Well, it's not that frequent, and you know, I will say, and I think it's important to get the message out that hospitals are safe places to go. We do not want people to delay care. We do not want people to not get preventive care. We want to make sure people get the care that they need, and the hospitals will take every precaution they can for all their individuals, not just those who are COVID positive, but also those that are going in for other procedures. I don't think it's as common. It, I'm sure, happens, but again, that's why we want to make sure everybody takes all the precautions. And remember, if you have any other physical ailment or, you know, heart disease or we want you to protect yourself because of those complication risks by COVID, but also if you have symptoms, get tested. And even if you don't have symptoms or you think you may have been exposed, get tested. Don't guess, take the test.
Okay. California news indicated that several large hospital systems turned away COVID patients who though seriously ill had no insurance. That sounds unethical. What is our local philosophy?
Well, I'll just say that, I mean, I do think that that's, you know, in my book, unethical. I mean, you know, we're hospitals and healthcare systems, and all of us, and that's the reason why we went into medicine and healthcare, and health is to help people. And so when you turn people away because of a lack of ability to pay, then that's really a shame on all of us as a society.
It's also illegal.
Well, that's true.
But it happens.
But I'm sure it happens.
Is it true that outdoor seating has no capacity limits in restaurants? They look rather compressed.
You know, I'm not sure about outdoor seating capacity.
Yeah, you know, indoor seating definitely has still capacity constraints, but outdoor seating has varying levels depending on what, you know, what the restaurant's, certain specifics about the restaurant itself. But, you know, outdoor seating still has requirements for how they should be doing, you know, so essentially a social bubble around the tables and things of that nature. But the capacity limits are probably not as much in play with the outdoor seating as they are indoor, for obvious reasons. You have air circulating, and you know, you've got an ability to try to get people more dispersed than you do indoors.
So you're recommending, if you just have to go to a restaurant, maybe choose to seat outdoors?
Look, the weather is fantastic right now. This is the time, and you know, in Houston, there is rarely a time in the summer you want to go out and sit there. This is the time when you can start to enjoy the outdoors, and really, you know, if you can, and plus you can still do takeaway. You know, take out, take away. You know, get your food, go to the park right next door, and eat it there.
Or maybe even go on a picnic.
There you go.
I did that this week for my birthday.
Hey,
Happy birthday.
Happy birthday. Okay, Dr. Shah.
Uh-oh.
When will the county threat level decrease?
You know, okay, so we talked a little bit about this with the positivity, and we talked about this last week as well. So let's just make it very clear that over the last several weeks, the one indicator, the main indicator that was keeping us back from getting from a red to an orange, and orange being a safer level, if you will, was test positivity rate. And that we had set that at 5%, and we were just dancing, as I said, plateauing at that 6%. Maybe it was under 6, but it was right at about 6%. In the last week or so, we've actually started to notice additional trends, and those indicators that include not just test positivity, but there are trends about cases in the community, hospitalizations in the healthcare system, ICU admissions in the healthcare system, and those trends are supposed to continue to be decreasing or flat, and now they're starting to do this. And so now it's not just the test positivity that would hold us back from going to orange, it's actually a couple of other trends as well. So right now I would say for the foreseeable future, I would not make the recommendation to go to an orange. If anything, I'm very concerned that people are forgetting the message of the 3 W's, wear your mask, wash your hands, watch your distance, and get tested. I think that's really my concern. So I wouldn't make that recommendation at this point.
I guess your observations actually are tied to an earlier question that we had.
That's right.
Haven't heard this question asked. Is it safe to breastfeed wearing a mask if you fear you may have been exposed to COVID?
I just read a study about that. A small number of pregnant women, I'm sorry, women who had given birth, who breastfed, and there was none of the mothers transmitted the virus to their babies. So no reason to think the virus is in breast milk.
Okay. Research history shows clinical
I did want to just make one comment, which is that if a woman is COVID positive and obviously is now postpartum and is thinking of breastfeeding, to contact and talk to their pediatrician or obstetrician to make sure that they get the appropriate advice. Yeah.
Absolutely.
Yeah.
Research history shows clinical trials in phase 3 have a 50% chance of success. If multiple trials succeed, how will doctors decide the best vaccine to give patients, or will this be more like go to a pharmacy or get whatever shot they have available, or will we be subjected to endless commercials? This is an important question, but go ahead.
Well, let me start with some of it, and then Kathy, you can just add to it. What I would start by saying is that, look, there are a lot of trials that are happening that phase 3 trials, there are, I think, 6 candidates, and 5 of the 6 candidates are a 2-shot. There's 1 of those 6 that's a 1-shot, 1 vaccine dosing, if you will. And the reality is that as these come to fruition and eventually come to distribution to community members, I think it's really, unfortunately, going to be what we've got. You don't know which of those 6 you'll get as a community, not as a Stephen or as a Kathy or as an Umair, but as a community. You don't know what you're going to get, but what you get, it's really going to be incumbent on all of us to figure out that limited number, how to get it to the most appropriate initial, especially people that should get it. And that is what both health departments are working on, the state is working on as well. And what we want to do is to make sure to emphasize that, is that when we have come to this conclusion in our country that the COVID vaccine is safe, it's effective, then we should all be lined up ready to take it, but we may not have a choice on what exactly the vaccine will be, because it'll be about what's available.
Yeah, and eventually, in a couple of years, it may become like flu vaccine. There's 4 different kinds out there. One's recommended for older individuals. One's only available for 2 to 49-year-olds. So it may be, again, eventually that some of the vaccines work better in certain groups than others.
That's right, yeah.
But we'll only know that over time.
That's right. But if it's available, we would want people to take, especially as we get into this 3rd wave, this real concern around flu season and being indoors and all the things that we talked about earlier, we want people to take the vaccine.
Right.
Johns Hopkins Medicine mentioned factor D protein that could prevent COVID. Can you explain this?
I don't know anything about factor D.
Yeah, I haven't looked at this one, so I was hoping this would be a Dr. Troisi question.
Yeah, sorry. I do a lot of research for Dr. Shah and others, and I haven't seen anything about that.
Well, maybe we'll have something by next week.
Right.
Yeah.
Right. The Lancet published a story about doubling Boston score that can predict which patients will develop a severe form of COVID.
Yeah, I read about this, and you know, again, there are a lot of mathematical models out there that are really trying to do what we call predictive analytics, that they're really trying to predict who's going to have milder disease, who's going to have severe disease, and this is one of those examples. I read about it, but not enough to see how replicable or you know, how consistent and accurate the scoring system is to actually do the predictive analytics. So again, I think more to come, but we are hopeful that we can eventually have systems where you can start to say, this individual is going to be milder symptoms, this one's going to have more risk for complications.
Yeah, and we do know some of that already
yeah.
from risk factors.
That's right, that's true, yeah.
I've taken 2 COVID tests. Do they get reported as 2 people or 1?
Yeah, so it depends, right? So if it's immediate, like within a certain few day period of time, it would be included as 1. But if you get it, let's say 3 weeks apart, then it would be included as 2, depending. So it just depends on how. Because sometimes what we're trying to allow for is somebody who goes to get tested, and maybe there's a concern that they have, and it's negative, and they come back a couple days later, and they have symptoms, and they just like, oh, I'm not sure, I completely believe it, or the doctor says go get tested again, and they get a repetitive test, and that comes back positive. Now it's really that one individual. So we still are trying to quantify it a certain way versus the individual who's coming back weeks later, and it's a second infection. That's where you want to, you know, classify it differently.
Okay, adaptive testing works backwards to identify how a person got infected. Contact tracing looks to see who you've been near and try to break the chain for the future by letting them know. Are we using both methods? Is one better than the other? Adaptive testing.
Yeah, you know, the purpose of contact tracing is to, as the question said, to identify people who may have been exposed. So we do that by asking positive cases who you've been around, who you may have been in contact with for a certain amount of time, certain distance. That's the mainstay of public health. That's, so it's really both. It's looking at cases who they may have been in contact with, and then identifying notifying those people that they may have been exposed.
Okay, the government in UK now believe whole populations testing once a week might restore normal life while awaiting a vaccine. Would that help in Houston?
You know, that's a hard question. First of all, we don't have enough testing to do that, and the cost right now is prohibitive for all of that testing. Each individual test might be only $5, but that adds up. All the test tells you is that right now you're not infected. So it may help, but there are logistical problems.
Right. What I would just add is that, you know, unfortunately, we've not had a national strategy. We've not really built up a national capacity, and at the end of the day, we've also not let public health from a national standpoint run this. And there is, you know, we talk about trickle-down effect. That's the trickle-down effect to states and localities. And so you've had 50 states that are trying to figure it out on their own. You've got communities, thousands around that are doing this as well. And so if we had different testing modalities early on, maybe we could have done something different. I'm not sure it would be as important right now at this point.
All right. When tests for COVID, what test for COVID is absolutely accurate? None. I keep hearing that even a fast response negative may require testing. They're talking about rapid testing.
Yeah, so we go with PCR test as being the gold standard, if you will. It still, as you said, isn't completely 100%, but it's the best we've got. There is an additional test that we do also look at, which is NAT, which can be similar to PCR. But antigen testing is the one that this individual is talking about, that antigen testing or even antibody testing. And that's where you start to get drop-offs in accuracy.
Okay, a second question regarding testing. A COVID rapid testing pilot program for Texas schools was announced. This sounds like a proactive plan, but does rapid testing give a false sense of security?
Well, I think we saw that with the White House, where there was rapid testing done and apparently a false sense of security. Again, the false negative rate, that is people who are truly positive but react negative on the test, is fairly high with these rapid tests.
Okay.
Better than nothing, but
That's right.
not perfect.
If I've had COVID, when can I volunteer to donate antibodies?
I don't know the exact timing of it. if you're trying to give blood.
Yeah,
Or a plasma.
they
Maybe
want
it's
to
more of a
wait,
plasma question, yeah.
at least 2 weeks, and I believe it's longer. I believe it's about a month.
Yeah, but don't they also test for the antibodies to see if the plasma? So it's probably best to contact the blood bank to get that question.
Yeah.
Okay, one last question. COVAX is the world's largest ever collaborative vaccine project. It aims to provide affordable vaccine to 20% of the world's population. This sounds great, but I've seen this listed along with conspiracy theories. What have you heard about this?
Well, I will say the one thing is that Dr. Hotez at Baylor College of Medicine, and they're working closely with a company out of Seattle called PATH, and I believe they're looking at 1 billion doses that they're going to be manufacturing in India. And this is talking about the global project that's really not just, not really the United States, but it's really globally what's out there. And I think the real issue is that conspiracy theorists and all this anti-vax movement is really going to impact all of the COVID vaccine, what's going to be put out there. And so we all have to make sure that science and evidence runs the day.
Okay, thank you for joining us for COVID-19 Talk with local health authorities. I want to give a special thanks to Dr. Kathy Troisi, infectious disease epidemiologist from UT School of Public Health, Dr. Umair Shah, Executive Director of Harris County Public Health. Thank you to Rotary Club of Houston, past President Kathy Finninger, who provides these questions. And I am Stephen Williams, Director of the Houston Health Department.
Kids will be kids, which just goes to say kids will be curious. They get into everything, everything. If there's a loaded firearm in the house, they could get their hands on that too. Keeping firearms locked, unloaded, and stored separately from ammunition in a place inaccessible to kids can help keep your loved ones safe from family fire. Safe gun storage saves lives.
Food, it brings us together, inspires joy, and gives us life. But we can't forget that during this crisis, over 37 million people don't have access to nutritious food. That's 1 in 12 seniors and 1 in 7 children. In fact, millions of kids aren't able to receive a free or reduced price school lunch right now. The good thing is, we can all help. Learn how you can get involved at feedingamerica.org. When we help each other, we nourish ourselves, our families, and our communities.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Whatever gets you talking. There are a lot of ways to reach out to a friend about their mental health. Whatever gets you talking. Learn how you can help at seizetheawkward.org. Worried about your friend but don't know how to reach out? You
could say how are you or get a fake tattoo. You can ask with an app if it works for you. You could chat with them in VR. It's all good if you think you should check in. Yeah, you should.
Whatever gets you talking. Reach out to a friend about their mental health. Whatever gets you talking. Learn how you can help at seizetheawkward.org.